Hi, good evening or good morning, wherever you are, everyone. Thank you for joining this session. Forum is also here. Thank you very much, Forum. And today, one topic that we are going to talk about, as suggested by Forum, is facts about rehabilitation towards the recovery process. We'll have a few minutes on that, 10-15 minutes, then we can take up any questions or queries. Someone had sent me a mail also. Meanwhile, I will look into that also. So we can take that. So over to you, Forum. Take it further from here. Thank you very much.
Sure, sir. Today, as the topic suggests, that we will be focusing towards the facts regarding the recovery for stroke. Whenever we get a patient for stroke or whenever we get an individual suffering from stroke, the first question asked to us is recovery कब आएगा? कब मेरा my mother, my father, my brother, something like that will start walking, will be using like upper limb movements, will be walking on her own or on his own. So there are some concepts which you need to concentrate, and according to that concepts you will get the answer from your neurologist, your physician, your physiotherapist, that when the recovery will come, and you need to keep all these concepts which we will be discussing today in mind, and relate it to your findings from your neurologist, your physiotherapist, or your physicians, or whoever is the first line of medical management from your side. Okay, so the first concept will be going towards its function. Before it just start, if anyone is fine answering, what do you mean by recovery or recovery of function? Can you just elaborate on what does it mean from your side?
Ma'am, I think a restoration of movement, like walking, moving his affected arms freely.
Okay, just remember
So
the word
being an OT, sorry to interrupt, being an OT, I can say that, being able to do things on your own, getting that, daily activities.
this is what I was focusing on. Restoration is not the word. First of all, the injury to the brain has happened. Now you cannot concentrate on restoration. Now you need to work on re-acquaintation. That is, whatever is lost, but you need to recover it by a use of compensatory techniques, as well as some of by the age or the treatment protocols or the treatment strategies we use to get recovery. It is not restoration. You won't get a normal function what the individual was doing earlier in some aspect. Yes, you can get, but it depends on several factors which we'll be discussing. But don't keep in mind कि मेरा individual जो पहले था, he will be working in the same pattern. There will be some compensatory strategies, some restorative strategies, which he will be using it to complete their task. As Purnima madam rightly told us that it is the main goal of treatment, or the main goal towards the recovery process is the individual should be independent in whatever task he has to manage in his ADLs or his day-to-day activities. It is not that वो पहले कैसे करता था मुझे वही पहले जैसा चाहिए. No, that won't happen, and you need to accept it and go on. You cannot stop कि ये नहीं आएगा तो I won't do. It will come, but it will come with some modifications, some compensations some compensations, and then the individual अपना काम खुद से कर पाएगा. So that is recovery of motor function, या recovery of function, or recovery in the process of stroke. Now there are some stages of recovery. We won't get into detail of it, but now we will be focusing on what are the effects or what are the factors affecting the process of recovery. The first thing is age. अगर स्ट्रोक इंडिविजुअल की एज ज़्यादा है, द पर्सन who is suffering from stroke has the age more, yeah, more than 60, 65, 70, 75, there are chances that the recovery डिले होगी या जैसी होनी चाहिए द इंडिविजुअल एट 45 वो रिकवरी वैसी नहीं आएगी. So age is a factor. Then comorbidities. If the individual is having diabetes, hypertension है, और कोई चेस्ट वाली कोई कंडीशन है, लंग इन्फेक्शन है पहले के, कोई एडिक्शन है जैसे कि स्मोकिंग, अल्कोहल, टोबैको, एनीथिंग लाइक दैट, अगर कोई हार्ट प्रॉब्लम है पहले का, एनी कोमॉर्बिडिटीज, तो रिकवरी थोड़ी डिले हो सकती है. द अदर थिंग इज we tell it characteristic of lesion. What is characteristic of lesion? जो ब्रेन में ब्लड क्लॉट हुआ है, हेमरेज हुआ है, या ब्रेन में ब्लड कम हो गया फ्लो करना, वो द ब्लड इज नॉट फ्लोइंग प्रॉपरली, वो क्लॉट हो गया है, कितना डैमेज उसने ब्रेन के स्ट्रक्चर्स को किया है. इट इज स्मॉल लीजन, बिग लीजन, और कहाँ पे वो क्लॉट हुआ है. ब्रेन में बहुत सारे स्ट्रक्चर्स होते हैं, हर एक स्ट्रक्चर का एक असाइन काम है. वो स्ट्रक्चर पे कैसे ब्लड कहाँ पे क्लॉट हुआ है, कितना क्लॉट हुआ है, दैट ऑन दैट टू द रिकवरी डिपेंड्स. थर्ड थिंग इज, as we tell, there is a golden hour for stroke therapy, yeah, medical management for stroke, as we had discussed in our earlier lectures too. So it is like स्ट्रोक हुआ, पेशेंट को सिम्टम्स दिखने लगे, द बी फास्ट वाले सिम्टम्स या कुछ भी सिम्टम्स दिखने लगे, बीपी रेज हो गया, कुछ भी, द ड्यूरेशन फ्रॉम द सिम्टम्स टू यू टिल यू गेट द मेडिकल, आप हॉस्पिटल पहुंचे, आपको हॉस्पिटल में कैसे ट्रीटमेंट दी गई, दिस ऑल डिपेंड्स ऑन. मोर आप डिले किया, सुबह कोई सिम्टम्स आए, आपको लगा कि नहीं ऐसा होता है मुझे, दिस एंड दैट, यू आर जस्ट इग्नोरिंग दैट सिम्टम्स एंड ऑल, एंड on the next day afternoon या next day evening morning you go to show the doctor कि मुझे ऐसा हो रहा है, तो the extent जो ब्रेन में डैमेज हो वो बढ़ता चला जाता है, and then the recovery process at the end gets वो थोड़ी कम हो जाती है, डिले हो जाती है. सो द एक्सटेंट ऑफ द लीजन और आपको कब मेडिकल मैनेजमेंट मिला, कितना ब्रेन डैमेज हुआ है, वो सब पे आपकी रिकवरी डिपेंड करती है. आप हॉस्पिटल पहुंचे, आपको कितने घंटे में मेडिकल मैनेजमेंट मिला, आप कितने घंटे में स्टेबल हुए, आपका बीपी नॉर्मलाइज हो गया, आपका जो भी आपने बेहोश थे तो होश आया, आपको कब तक होश आया, आपको और कोई तकलीफ हुई उस टाइम, दैट ऑल डिपेंड. द हॉस्पिटल का सिनारियो भी आपका रिकवरी प्रोसेस में डिपेंड करता है. ओके, देन एज आई टोल्ड यू, प्री एग्जिस्टिंग स्टेटस. प्री एग्जिस्टिंग माने स्ट्रोक हुआ है उसके पहले पेशेंट कैसा था, बहुत ओबीस था, बहुत वेट था उसमें, या एक्सरसाइज नहीं करते थे वो लोग, डाइट में डाइटरी माल नरिश्ड है, डाइटरी फंक्शनिंग, डाइटरी सप्लीमेंट्स अच्छे से नहीं है, डाइटरी रिक्वायरमेंट्स उनके जो थे वो फुलफिल नहीं हो रहे थे. देयर आर several other factors that affect the recovery process of the individual. Now, if it is possible, I will show you a schematic diagram from one of my books. Is it visible to you all? Clarity नहीं है शायद.
No, you'll have to bring it closer, perhaps, Forum.
Is it visible now?
आप थोड़ा सा होल्ड करेंगे, then it is slightly visible.
Yeah, I am holding it.
Yes, one slightly. Of course, you'll have to elaborate because some
Yeah,
words
I'm just elaborating
Okay.
it, but just see the we will just divide the recovery process into two. That is, one is biological factors and one is environmental factors. Just go through biological factors if you all can. Age है, you can see over here, age है, फिर लीजन है जो हमने डिस्कस किया, फिर जेनेटिक है जो हमने डिस्कस किया, वेट, जेंडर, ब्रेन टॉपिक फैक्टर्स माने ब्रेन में कितना लीजन है और वो सब. देन कम्स एनवायरमेंटल फैक्टर्स. एनवायरमेंटल फैक्टर्स माने what are the post injury factors, that is pharmacological management जो हमने डिस्कस किया, और प्री एग्जिस्टिंग फैक्टर्स दैट इज योर एक्सरसाइज, आपका एनवायरनमेंट कैसा था और आपका डाइटरी रिस्ट्रिक्शन कैसा था और डाइटरी रिक्वायरमेंट्स कैसी थी, वो फुलफिल हो रही है नहीं. All these are the factors that depend on your recovery process. Is it clear to you all? कोई डाउट इसमें?
Where would you put attitude forum?
Attitude comes under personal factor. That is, it can come towards your the ICF classification जो हमने last time की. I don't know how many of you have attended that class. वो ICF मॉडल था जो हमने डिस्कस किया था, उस पे रिहैब प्रोटोकॉल बेस्ड होना चाहिए अभी. The attitude in that condition comes on personal factors of the individual.
Okay, and what about, for example, the economic factors or the family factors?
That comes in the environmental thing, post injury environmental thing. Just let me show ICF if I am able to. As I
It
don't.
also, it's like a social support also, like a social network that you have.
Yeah, that all comes under the. Let me show once. Wait. ICF. Wait. Let me.
Let me also make you the co-host.
Just give me a minute. Can I share my slide?
Yes, you should be able to. I made you the co-host forum.
Yeah. ICF. ICF. I'm not able to get that.
You should be able to share your screen as well.
I'm just sharing my screen. Can you just say this?
Yes, there is something there. Yes.
Can you just see this ICF model? Just concentrate on this ICF model. It has, this is just an example for elderly. We need to write only stroke over here. It has body functions and structures. There is activities and there is participation. See the body function and structures. Here it depends. There are some कितनी इंजरी हुई है, what is the injury level, what is the cognition level, पेशेंट कैसा कॉन्शियस था, वो सब यहाँ पे आता है. देन इट कम्स टूवर्ड्स एक्टिविटीज. एक्टिविटीज माने उनको डेली एक्टिविटीज में कौन कौन सी डिफिकल्टीज है, दैट वी राइट हियर इन एक्टिविटीज. दैट इज एक्टिविटीज लिमिटेशन एंड दैट इज पार्टिसिपेशन. पार्टिसिपेशन माने हम फॉर एग्जाम्पल टेक कि मेरा माई इंडिविजुअल इज नॉट एबल टू वॉक, वो चल नहीं पा रहा है, तो वो चल नहीं पा रहा है, तो कौन से पार्टिसिपेशन. पार्टिसिपेशन इज रियल लाइफ कंटेक्स्ट में उनमें क्या क्या वो नहीं कर पाएंगे. he won't go out for roaming about, he won't go to temple, he won't go to shopping, मैरिजेज में नहीं जाते हैं, वर्क अफेक्ट होता है. दिस ऑल कम्स इनटू पार्टिसिपेशन. एंड why is this participation getting restricted or why is this activities getting reduced? It all depends on these two factors, that is your environmental factors or and your personal factors. जैसे अभी हरदीप जी ने मुझे बोला कि एटीट्यूड कौन किस में आता है. एटीट्यूड कम्स अंडर पर्सनल फैक्टर्स. more the positive attitude, more the recovery, more the activities, enhancement in activities through physiotherapy, more the participation. Okay. अगर environment is like my patient is able to walk even surface में, घर में चलते हैं, बाहर नहीं चल पाते. बाहर क्यों नहीं चल पाते? इज इट ड्यू टू के रोड्स अच्छे नहीं है, ट्रांसपोर्ट फैसिलिटीज नहीं है, ट्रैफिक बहुत ज़्यादा है. That all comes under environmental factors. Economic status of the individual comes under personal factors, but the support from others, yeah, social group, so the group like us, that comes in the environmental factors. Is it clear? So
Yeah, okay.
whenever we are predicting recovery, और आप जब भी रिकवरी एक्सपेक्ट कर रहे हो आपके इंडिविजुअल में, अगर वो आपका फिजियोथेरेपिस्ट, न्यूरोफिजिशियन, एक्स वाई जेड कोई ये चार्ट नहीं बना रहा है आईसीएफ का, बट टेक हेल्प फ्रॉम देम. वॉट एवर यू अंडरस्टैंड फ्रॉम नेट, गो ऑन, जस्ट अंडरस्टैंड वॉट इज इन योर लेमन लैंग्वेज. आपके रोज के लैंग्वेज में आइडेंटिफाई करो कि कौन सी एक्टिविटीज कम है, कौन से पार्टिसिपेशन कम है, और क्या क्या फैक्टर्स अफेक्ट कर रहे हैं ये एक्टिविटीज में और ये पार्टिसिपेशन में. एंड जस्ट लिंक ओवर इट कि ये एनवायरमेंटल फैक्टर ये है तो वॉकिंग नहीं आ रहा है, पर्सनल फैक्टर्स ये है तो वॉकिंग नहीं आ रहा है. एंड देन जस्ट जॉट डाउन कि मैं ये मॉडिफाई करूँगा तो वॉकिंग आएगा, ये मॉडिफाई नहीं कर पा रहा हूँ तो आई जस्ट वांट टू लिव इट एंड स्टार्ट वर्किंग ऑन अदर फैक्टर्स विच आई एम एबल टू मॉडिफाई, और मेरा इंडिविजुअल या आई विल गेट अ रिकवरी स्ट्रॉन्गर. ओके, इज इट फाइन?
Yeah.
सो यू जस्ट नीड टू ये सब अपने हिसाब से. दिस विल बी डिफरेंट फॉर ईच एंड एवरी इंडिविजुअल. तो अपने लेवल पे आप खुद वर्क करो. देयर विल बी सम फैक्टर्स विच यू विल बी एबल टू मॉडिफाई, देयर विल बी सम फैक्टर्स यू वोंट बी एबल टू मॉडिफाई. एज हम मॉडिफाई नहीं कर सकते, जेनेटिक हम मॉडिफाई नहीं कर सकते, लीजन जो हुआ वो हम मॉडिफाई नहीं कर सकते. बट येस, we can modify attitude of the individual, we can modify some environmental factors. असिस्टिव डिवाइस दे सकते हैं, ये दे सकते हैं, वो दे सकते हैं, सपोर्ट दे सकते हैं. ऑल दिस मॉडिफाई फैक्टर्स जो आप वर्क कर रहे हो, आप वर्क करो एंड देन यू विल कमेंट ऑन द रिकवरी प्रोसेस. Nowadays we all work on ICF model rather than सिर्फ ये करो ये करो ये करो. That won't work. Every stroke individual is different. उनके नीड्स डिफरेंट है, उनके गोल्स डिफरेंट है, उनके एनवायरमेंटल फैक्टर्स डिफरेंट है, पर्सनल फैक्टर्स डिफरेंट है, Modifying each and everything, we need to modify and give a tailor-made protocol for each and every individual, and then we can get a recovery faster. Any doubt?
See, ideally, this will be done, this kind of analysis will be done by the affected or maybe by the immediate family caregiver. क्योंकि
With the
उनको
help of only, not only immediate caregiver, but sitting with the patient itself. Include patient and then create this ICF model.
Because they know them, very
Yeah.
closely where their gaps could be for them. So then they can, focus on what they can work on. Can the physiotherapist also, or can the maybe guide or maybe help? देखिए ये चीज आपसे नहीं होगी, ये चीज अभी आप रहने दें, ये चीज पे फोकस करें.
Yeah, this is the role of physiotherapist. That is what I am telling you. That is what we had discussed earlier also. कि हर एक पेशेंट डिफरेंट है. We only need to, अगर मैं पेशेंट हूँ, मैं ऐसे नहीं खा पा रही हूँ आफ्टर स्ट्रोक, आई विल जस्ट मॉडिफाई माई वे ऑफ ईटिंग दिस वे. और हमने स्ट्रोक में देखा होगा कि वो पैर घुमा के चलते हैं. ओके, सो at a stretch I cannot break that pattern of walking, because बहुत सारे chronic patient है, बहुत सालों से stroke है, they won't change that pattern because वो used to है वो pattern से. okay, so वो पैटर्न से मैं उनकी एनर्जी कैसे एफिशिएंट बना सकती हूँ, उनका वॉकिंग कैसे एनर्जी एफिशिएंट, माने वो कम थके, उनको कुछ डैमेज ना हो, गिर ना जाए, तो उनको कुछ लग ना जाए. That I can modify with including that strategy, instead of telling them constantly ऐसे मत चलो, ऐसे मत चलो, ऐसे मत चलो. That will deteriorate their confidence level. Rather than I will just make some minute changes in that individual, उनको वो प्रैक्टिस करवाऊंगी, धीरे 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 वो पैटर्न चेंज हो सकती है. The second scenario we take in individual who has just started walking, सब acute phase में है या going towards chronic है. So instead of training him in doing that strategy, I will just tell him, थोड़ा modification करूंगी, उनको normal gait pattern में लाने की कोशिश करूंगी. There is nothing normal, but it is always energy efficient. क्रोनिक में पेशेंट खुद सोच लेता है कि मुझे ये मेरी एक्टिविटी ऐसी है, मुझे ऐसे ही करनी है. वी कैनॉट चेंज बहुत सारा थिंग इन क्रोनिक पेशेंट, बट yes we can change something in acute, subacute and going towards chronic वाले पेशेंट with the help of that walking strategies and gait rehab, what we had discussed in previous 6 lectures.
Yes, okay.
So there is a linkage from the previous lectures, and you need to link this lecture.
Ma'am, one question I have. Chronic stage, you mean to say duration क्या होता है इसका? After post 1 year?
See, it can be post 1 year, post 1.5 year, or more than 3 years. But the thing is, here as हरदीप जी बहुत सारे बार बोलते हैं, neuroplasticity or recovery comes at every stage of your stroke, or there may be acute, subacute, chronic. पर एक बात याद रखना, क्रोनिक में रिकवरी थोड़ी स्लो आती है, यू वोंट सी दैट पीक वाला ग्राफ, but in yes acute, subacute, you can see that peak wala graph, but neuroplasticity continues throughout, so you need to keep on working, keep motivated and keep working.
मैम ऐसा है कि आफ्टर 6 months स्लो हो जाता है या स्टॉप हो जाता है?
स्टॉप नहीं होता,
तो
कोई चीज स्टॉप नहीं होती. हाँ, स्लो हो जाती है, बट डिपेंड्स ऑन हाउ द रिहैब प्रोटोकॉल इज गोइंग.
ओके.
This is an issue we repeatedly discussed in the groups also. And the fact of the matter is, for example, saying कि भी अभी ये chronic phase में चला गया है, that also is subjective perhaps. You
Very
cannot,
subjective.
sorry?
Very subjective.
Because I really don't know how can one say कि भी अभी chronic है और अभी या recovery, yes, perhaps the rate of recovery one can, determine, because it is obvious, one can make it out कि पहले ज्यादा थी अब धीरे हो गई है. But perhaps अगर maybe अगर जैसे कुछ प्रोटोकॉल चेंज किया जाए या कोई एक्सरसाइज चेंज करी जाए, maybe that can change. जैसे कई बार लोग कहते हैं कि प्लेटो आ गया है, अब तो कुछ नहीं हो रहा.
Yeah.
So maybe at that time trying some other exercises or maybe trying some other let's say physiotherapy exercises or even in some cases some protocols, जैसे वर्मम therapy. See, why do people shift to or try alternate therapies? Although I hear you, Forum, you say there is no evidence, etc. But the fact remains कि people.
मेरा इंडिविजुअल हो अगर the relative is from my side या the thing is हर एक रिलेटिव में एक hope of recovery होती है. There can be combination of therapy or stick to one therapy, but the hopes of recovery हमें the relative is free enough, the stroke individual is free enough to take any line of treatment. We cannot stop anything. We can just warn them, but we cannot stop them.
See, वही बातें है ना. See, अगर जैसे प्लेटो आ गया, let's say, I'm trying to put myself in the patient's shoes. प्लेटो आ गया, कोई इम्प्रूवमेंट नहीं हो रही, अब मैं क्या करूं? See, so okay, ये alternate treatment try कर लूं, maybe it will help me, maybe it will not help me. As long as it is, perhaps financially amenable to me, और मेरे को उसका कोई apparent damage नहीं दिखता है. मैं एक्सरसाइजेस पे तो प्लेटो कर चुका हूँ, मेरे को ज्यादा कुछ दिख नहीं रहा है, तो चलो अब ये भी ट्राई कर लेते हैं. वो बात की बातें हैं, क्या होगा क्या नहीं होगा. बट एट दिस स्टेज इन माय फ्रेम ऑफ माइंड, आई विल से कि ठीक है भाई, ये भी ट्राई कर लेते हैं. दैट इज वेयर द and of course there is lack of evidence, etc. But the fact remains that as a patient or as a patient's family, that's a concern that they are facing. So we have to see what can be done there. So anyway, I think this is a good framework जो आपने present किया. That is some.
The other thing is, sir, sorry to interrupt you. Other thing is there is no बहुत सारे therapies, maybe physiotherapist या physical therapy. It is like वो monotonous हो गए कि stroke patient आया तो इतना इतना करवा लो. But there is a thing कि हमें हर एक, as I tell every time, it is like जो मेरे lectures attend वो बोलते हैं एक ही बार क्यों बोलती रहती है. But I always tell, पहले पेशेंट को बोलो गोल्स बनाए, थेरेपिस्ट उसको हेल्प करे वो गोल्स बनाने के लिए, फैमिली हेल्प करे वो गोल्स स्टेटमेंट बनाने के लिए. वी ऑल वर्क टुगेदर एंड देन वी फ्रेम अप rehab protocol, practice it at home, give some modifications, because each and every stroke individual is different, relatives different है, perspectives different है, relatives के perspective different है, therapist के perspective different है. So we all need to work together for every stroke individual and then made a rehab protocol. In chronic stroke individual too, it is like अगर मैं आपको बोलूँ कि एवरी हर रोज जाओ थेरेपी सेंटर में, वही एक्सरसाइज कंटिन्यू करो एंड डू दिस डू दैट डू डोंट डू दिस डोंट डू दैट, will you be getting motivated for doing same exercise every time? No, it is not possible. Hence the attainment of that exercise protocol, motivation level of the individual धीरे 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 घटता जाता है, बिकॉज इन दैट मोनोटोनस प्रोटोकॉल द पेशेंट वोंट गेट रिकवरी. अगर मैं ऐसे ऐसे करवाती रहूं, व्हाट इज द एम ऑफ डूइंग दिस एक्सरसाइज? वो तो कोई गोल में लिखा भी नहीं है कि मुझे हाथ ऐसे करना है. मेरे गोल में क्या लिखा है? मुझे खाना खाना है या बुक शेल्फ पे से बुक लेनी है मेरी, तो वो एक्सरसाइज अच्छी रहेगी. पेशेंट को मोटिवेशन रहेगा कि ना मुझे वो बुक लेनी है, या आई एम डूइंग दिस एक्सरसाइज फॉर टेकिंग दैट बुक फ्रॉम द शेल्फ which had a goal in my paper. I am achieving that goal धीरे धीरे. My checklist is टिक 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 हो रहा है. तो मोटिवेशन चेंज होगा, मोटिवेटेड रहेगा, एक्सरसाइज चेंज करते रहो, गोल अटेंड हुआ तो वो एक्सरसाइज डिसकंटिन्यू करो, दूसरी एक्सरसाइज इंक्लूड करो. एज हरदीप जी राइटली टोल्ड के क्रोनिक है तो भी एक्सरसाइज थोड़ी थोड़ी मॉडिफाई कर सकते हैं. वी कैन नॉट स्टिक टू दैट वन सिंगल एक्सरसाइज. जो बुक में लिखा है वो ही नहीं, दैट इज नॉट पॉसिबल फॉर एवरी इंडिविजुअल. सो टेलर मेड प्रोटोकॉल इज इम्पॉर्टेंट. केयर गिवर और पेशेंट को सेंटर में रख के कोई भी प्रोटोकॉल बनाओ. एंड आई टेल यू, आस्क योर थेरेपिस्ट कि ये एक्सरसाइज क्यों करवा रहे हो, व्हाट इज द गोल ऑफ डूइंग दिस एक्सरसाइज. ये मेरे 5 गोल है, मुझे ये अटेंड करने हैं, मेक माई प्रोटोकॉल अकॉर्डिंगली. या मैं आप ये करवा रहे हैं, उसका एम क्या है आपके लिए, how will be able to achieve that goal. That is all important. You need to ask. अगर वो थेरेपिस्ट आके करवा के चला जाएगा 45 मिनट्स 1 आवर, 2 टाइम आएगा, बट व्हाट इज द गोल, व्हाट यू हैव अचीव्ड, दैट इज इम्पोर्टेंट.
Sure. At the same time, also, as you said, Forum, maybe a kind of comfort zone or a kind of complacency also sets in, with time. ठीक है भाई, अब जो हो रहा है इतना ही है. But again, let me ask you again a carry question from there. Will it also be useful at that time, maybe to look at another physiotherapist?
Sir, to answer this question, just take, as we have discussed many of the things looking at the examples, okay. एक थेरेपिस्ट आके करा जाएगा, okay. The other therapist will come in the evening, make the patient do exercise.
No, I'm not saying कि morning में दूसरा और evening में दूसरा. What I'm saying is
just giving you example. एक थेरेपिस्ट आया, आप उनके पास गए, उन्होंने आपको 1 आवर में ये एक्सरसाइज करवा के दी. मोस्ट कॉमनली वो करवाएंगे वो वेट बेरिंग वाला एक्सरसाइज, कमर में से ऊंचा करने वाला एक्सरसाइज, पैर ऊपर नीचे करो, हाथ ऊपर नीचे करो, वो पैक बोर्ड वाला एक्सरसाइज जो कॉमनली यूज होता है. दिस आर द मोस्ट कॉमन एक्सरसाइजेज. या शोल्डर वाला कोई एक्सरसाइज, दिस आर द मोस्ट कॉमन एक्सरसाइज. बट कैन द रिलेटिव्स आस्क कि ये एक्सरसाइज क्यों करवा रहे हो. You will not see the recovery. There is a question to be raised कि मैं इतने दिनों से करवा रहा हूँ, रिकवरी क्यों नहीं है, okay. And then you can switch to your to other therapist. But the main goal is therapist change करने से कुछ नहीं होगा. You need to, it is like मेरे में नॉलेज नहीं है तो आप सामने वालों को पूछो कि ये क्यों नहीं है, so that he searches for evidences and come again to you and do a right therapy. क्योंकि there are small bunch of people who will be focusing on ICF, goal oriented, task oriented training in India. So how much you will change? So it is important that awareness should be created from the patient side or patient's relative side, and then go ahead. That can be done since we are conducting these sessions.
Sure, yeah, that's right. Yeah, of course, I hear you. I think own awareness is the first step, and then of course also depends upon what the physiotherapist is saying and what is, because everyone will have their own experiences also. They'll be factoring in their own experiences. That is also a factor to be considered. Fine, I think we have discussed enough on this. Thank you very much, Forum, on the topic. I think we are, and the ICF framework, we can discuss that, and I'll be maybe putting that slide up also in the group as well. Let us spend some time on some queries. If anyone has queries, you can, specific queries, maybe about 10-15 minutes, Forum.
Yes,
we can
sir.
spend it.
Yeah, sir. Just give me a sec.
Okay.
वो फिजियोथेरेपी के पास भी जाएंगे.
I'm saying Wilson and Anandi ji also. How are you, Anandi ji and Wilson?
Yeah, I'm fine.
How's Giridhar doing now? I hope some stability.
So there,
and
there
some
has been a regression actually. He, after the last admission in the hospital, actually I could not join the this discussion earlier because the physiotherapist is coming and doing the same thing what the attendant is also doing. I'm not seeing any change in his stance. You know, he's able to get up a little bit, but he's not able to stand up properly. Earlier he used to walk, like he used to drag his feet, but he used to, you know, support himself and walk. Now I think the back is not supporting him. Though there has been some changes, but
okay,
I don't
let's
know whether
open
there
it
has
up
to be.
to to Forum and to Punima, who with your expertise. Forum, you are aware of Giridhar ji? He had an epilepsy.
I'm aware. How is he now?
That's what, no, his back is not supporting him. He's walking only with the attendant's support. So now, if the attendant, normally he has his family in Gurgaon. So Saturdays he goes off for about 4 to 5 hours. So now I've started dreading that because even if I have to take him to the washroom, it's not possible. And at times, you know, like there is no bladder control and the diaper, sometimes I have to change the diaper. So he's not able to stand properly.
Core strength is very important. Core means trunk, like Forum said. So you can even, I mean, if the physical therapist can work on the core strength in laying down first, get the strength in laying down. Standing up is like you're being against gravity. So making those bridges and doing those that might be helpful too, because if trunk is not strong, it's just not possible to get better with your sitting or standing.
But I don't even know whether the exercises that are being done is going to bring in strength to his trunk. The leg exercises are going on, but he's not cooperating with the physiotherapist, but he does that with the attendant.
Forum, you can jump in, showing about how you would do the trunk, the core stretching. That is the strengthening. That's what I mean. Is that control has to come in that core trunk balance. Otherwise, people cannot stand up.
When he's lying down, when he's asked to, like lift his back, he does that. Okay, but
is
then,
he able to come to sitting from laying down? Can he sit up by himself?
Yeah, if there is a support, because we have fixed some support on the sides, so he tries to get up and he holds that iron railing and tries to sit up on his own nowadays.
That's another way. So do it on the affected side and unaffected side, both sides. So that will help him to get stronger there, and that might help him to get stronger. Agree, Forum?
Yes, I completely agree. The other thing is, as you told, sorry, Purnima ma'am, I'm just contradicting to your statement. First thing is, as you told, that core should be strong. But Anandi ji ने जैसे बोला कि core he is able to breach in lying position. That means his back strength may be almost 3 plus, and I'm just without visualizing, without checking muscle strength, I'm just telling you this, okay? So ये ऐसा हो तो why if the individual is able to breathe, वो लाइन में कमर ऊपर कर पा रहे हैं, तो माने कोर स्ट्रेंथ इतनी तो है कि वो अपने आप से रोल कर पे बैठ पाए, because against gravity he is able to lift his back. Okay, so one thing is, as I told you, अगर हम कमर ऊपर नीचे कर रहे हैं तो इज दिस एक्सरसाइज ट्रांसलेटिंग इन योर डे टू डे एक्टिविटीज जो हमें इम्पॉर्टेंट है. ब्रीजिंग कई पेशेंट को इम्पॉर्टेंट होती है ड्यूरिंग अक्यूट फेज, क्योंकि हमें बैठपन और वो सब के लिए वो ब्रीजिंग चाहिए. So that is functional activity for individual who is in acute and subacute phase, वो ऊपर नहीं कर पा रहे. अभी आपके जो हस्बैंड है, he is into chronic stage as I know him. Chronic माने more than 6 months, if I am very sure of it.
You are talking to me?
Yeah. Okay. So the thing is, वो ब्रीजिंग, वो कमर उठाने वाली एक्सरसाइज, वो हमारे डे टू एक्टिविटी में काम आनी चाहिए. अगर वो कोर स्ट्रेंथनिंग के लिए है तो ही शुड बी एबल टू गेट अप.
Okay, so if he holds the non-affected side से वो hold करके railing को, he gets up.
Okay.
Now.
So that is completely fine because we cannot emphasize कि वो affected side से पूरा वजन ले पाए. So that is completely fine. हमारा गोल क्या है कि वो खड़े, वो बेड पे से घूम के वो बैठने चाहिए. But we cannot emphasize due to his medical condition now. हम वो emphasize नहीं कर पाएंगे वो affected side से वो रेलिंग पकड़े और पूरे वजन ले. Our goal is वो बैठने चाहिए अपने आप से बेड पे, रेलिंग पकड़ के. With support he is able to sit on his own. That is our goal.
Okay.
Okay. So वो ट्रेन करो, जैसे पूर्णिमा जी ने बोला, वो ट्रेन करो, वो उसका रिपीटेशंस बढ़ाओ.
Okay.
So that he gets confidence in himself. उससे ही स्ट्रेंथ बढ़ेगी. More the repetitions you do, वो मूवमेंट भी अचीव होगा, वो धीरे धीरे स्ट्रेंथ भी बढ़ेगी.
Okay.
दूसरी चीज, आपको फाइंड करना है कि वो बैठ के खड़े क्यों नहीं हो पा रहे. What are the reasons he is not able to? वो उनकी मोटिवेशन कम है, कॉन्फिडेंस कम है, बैलेंस लॉस, गिरने का ज्यादा डर है, बैलेंस लॉस कर देते हैं, कोई सरफेस में प्रॉब्लम है, पैर अच्छे से नहीं रख पा रहे हैं, पैर पे फोर्स नहीं रख पा रहे हैं. दिस आर इन जनरल व्हाट आई सी कि ये रीजंस होते हैं दैट पेशेंट इज नॉट एबल टू. बेड की हाइट कम है, उनको सपोर्ट कम पड़ रहा है, ही इज वेरी कंफर्टेबल विद द अटेंडी, उनको विश्वास है वो अटेंडी पे कि वो मुझे गिरने नहीं देगा. These are some of the things I know. It will, I don't see that it will be same for your stroke individual too, but you need to find.
Yes.
And then break the task. Sit to stand एक पूरा टास्क है जिसमें
Okay.
5 to 6 स्टेप्स है.
Okay.
जैसे मैंने मेरे प्रीवियस सेशन में बोला, जस्ट ब्रेक द सेशन, ब्रेक द टास्क.
Okay.
पहले सिट टू स्टैंड करवाओ तो थोड़ी हाइट पे कराओ, थोड़ा घूमो, बैठो, बैठ के सपोर्ट लो, सिटिंग में सपोर्ट लो, पैर अच्छे से रखो, थोड़ा दोनों हाथों के सपोर्ट से आप खड़े होने की ट्राई करो.
दूसरा हाथ तो यूज नहीं कर पाते हैं, वो राइट हैंड ही इज नॉट एबल टू यूज.
डोंट एम्फसाइज इट.
ओके.
बट द थिंग इज वो सपोर्ट से धीरे धीरे थोड़ी थोड़ी प्रैक्टिस करवाओ. धीरे 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 ब्रेक द टास्क, break the task and then do that repetitions बढ़ाओ.
Okay.
Just quick one suggestion here. Sit to stand sometimes helps if somebody is sitting in a chair. If the back is not supported on the bed, it becomes very challenging. There's so much fear there. बहुत fear होता है. So it is better you sit to stand from a chair. You practice that from the chair.
और थोड़ा height पे.
Height is always a good idea. More height, जितना ऊपर बैठे उतना अच्छा उनको इजी पड़ेगा खड़े होने में. और चेयर से प्रैक्टिस करो instead of the bed. So what happens is it becomes so much easier for him to push from the chair. Of course, the chair with the armrest. क्योंकि हाथ एक लेफ्ट हैंड से उसको पुश करके he can come up. So that is a good way to go. And making sure the feet are touching the floor. अगर पाँव टच नहीं करते ग्राउंड को तो बहुत फियर रहता है. Also check is this if he feels ground is uneven. So there are so many factors, but make it easy for him.
और चेयर दीवार से टिका के रखो, बिकॉज इफ चेयर पे पीछे सपोर्ट नहीं रहेगा टेंडेंसी ऑफ फॉल.
That. No, he's not able to get up from the chair without support.
And the thing is support हमेशा साइड पे से दो.
अच्छा.
सिट टू स्टैंड करवाओ तो द थिंग इज सिट टू स्टैंड करवाओ तो यहाँ पे पेशेंट रिलेटिव को बोलो कि यहाँ पे बैठे चेयर पे साइड पे बैठे. इफ इट सिट्स इन फ्रंट तो जो मोमेंटम चाहिए ट्रंक का सिट टू स्टैंड करने में दैट इज गेटिंग रिस्ट्रिक्टेड.
ओके.
सो it is the thing is चेयर पे है पीछे तो थिंग इज 1 2 and 3. And
okay.
the thing is, the push should be from the trunk. The attendee, you should help from the lower trunk.
Okay.
Give support from.
So that person has to stand on the side and push him from the back. Okay.
The other thing is, always make sure he's not pushing back. Lot of our patients tend to push back. Can you demonstrate?
Yeah, sure.
What people do?
Yeah, the thing is they get up in this manner. Yeah, they will be not bending down. Emphasizing आगे झुक के. अगर वो ऐसे सीधे खड़े हो गए तो there is tendency to fall back. Extension पे जाके नहीं, ये वाला नहीं होना चाहिए. It should be this.
आगे होना चाहिए. You have to bend forward.
Bend.
Because half the body weight also goes away if they learn to lean forward. It is a very basic idea. Work with your physical therapist. वो PT आपको सिखाएंगे कि आगे कैसे झुकना है.
The thing is, if you just a rough demonstration of sit to stand, if you need to do it, it should be like both the feet on the ground. जैसे पूर्णिमा जी ने बोला 2 चेयर लगाओ पर feet नीचे होने चाहिए touch. Chair पे arm rest. Just do this momentum. Just make him do this. 1, 2, 3. Just practice that. 1, 2, 3. फिर धीरे धीरे बैक पे सपोर्ट दो. Momentum दो. Bend करो. Then it will be 1, 2, 3. And then 1, 2, 3.
Okay.
So break the task. Give proper support. Feet ground पे height बढ़ा दो. दोनों साइड चेयर लगा दो. आगे मत बैठो और support from the affected side if possible. Because he will be holding from the
support from the affected side.
If possible, but he will be holding it. The chair का armrest तो वो hold कर ही रहे होंगे. So he should not lean on affected side. So और पैर भी खिसक जाएगा पीछे. Bend forwards and then. हाँ, अगर वो affected side पे नहीं तो there are chances कि वो fall करे या पैर पीछे खिसक जाए. And the other thing is, अगर हम sit to stand कर रहे हैं तो पेशेंट की हमेशा टेंडेंसी होती है कि वो अफेक्टेड साइड जिसमें स्ट्रोक नहीं है वो पीछे रखे और जो स्ट्रोक वाला है वो आगे रखे क्योंकि हमारा हमेशा बॉडी वेट पीछे के पैर में ज्यादा आता है. ओके. और बोथ द फीट आर ऑन द सेम लाइन. या फिर अगर आप इनिशियली ट्रेन कर रहे हो 1 वीक, यू कैन कीप द अफेक्टेड नॉन अफेक्टेड साइड पीछे और फिर सिट टू स्टैंड करवाओ और फिर धीरे धीरे दोनों पैर एक लेवल पे लाके रख सकते हो. यू कैन डू दिस.
ठीक है.
But support should be on the affected side. That is the
on the affected side.
On the affected. So he will also have more confidence and he will be able to do. Yes.
Chances of fall decreases tremendously.
Yeah, and then he will feel confident that I'm not going to fall. So the attendant always has to be on the affected side. Support from there. Always.
और साइड पे all the therapists have a tendency वो आगे बैठते हैं. आगे नहीं बैठो वो momentum decrease हो जाता है. 1, 2, 3.
And that electrical, that stimulation that is being given, does that help?
Never during therapy. Never during therapy.
No, the physiotherapist who comes, भैया एक बार आप भी सुन लेना. The physiotherapist who comes, he has started putting that machine on. Half an hour goes in that. फिर एक बार चला के वो चले जाते हैं.
No, that is cheating.
Yeah. You are being.
Okay, so now I'm going to stop that because I felt that it's not working.
Never. Therapists should waste time in giving the e-stimulation. I've seen that tendency in India a lot. People come and give the electric, and when it's not all the therapists do that. There are good therapists, but there are few. But that is wasting your time, patient's time, and their time. It does not help, first of all, during therapy. So don't let them do that.
Okay. He has been doing this since the last 1 month. And initially, he was also reluctant. He said that, this is all artificial. He will not do anything on his own. Okay. I'll stop there. Thank you for advising.
Okay, if anyone else has any questions at this stage, I'm seeing Shruti ji, you had some queries. Then, yes, Shruti, you can speak up.
Yeah.
Although we are at 9:30 forum, whenever you say, okay, whenever you say, we can close the meeting. We can't hear you, but whenever you say, okay.
I was open for queries now. It's
okay.
fine.
Okay. See, our therapist says, since the hand is like this kind of a synergy pattern, now it is reduced to some extent. So it comes like this. So now what he is telling is, to get more improvement, he says, do this exercise, make him do this kind of movement to the sides and to the front. So how much that will be helpful?
That will be helpful in maintaining strength and mobility of the shoulder joint, but as I told you, आपने गोल नहीं भेजे सकती थी.
Thank you.
पूर्णिमा जी, आप कुछ बोलना चाहे तो just correct me if I'm wrong.
Any movement is good. Any movement is good. So that all gives the mobility. So, the problem is not the strength, it is the motor control. So understand that, you don't want any resistance, but you want to be able to move. अगर अपने आप नहीं हो रहा है तो दूसरे हाथ का हेल्प लेके मूव करो. और वन ऑफ द थिंग इज, मैंने देखा है कि अगर जो हाथ ऊपर नहीं उठ रहा है तो जस्ट लीन फॉरवर्ड, let the arm hang on the side. Forum, can you demonstrate that? Just the protraction of the shoulder, and lean forward. I'm not ready, that's why I'm not turning on the video.
Yeah, sure, ma'am. It's not just lean this way, so that.
Yes, you can do sitting also, standing also. This is great.
But if sitting, I'm not able to demonstrate exercises. That is why I got
Yes.
it got. You can just do this. Any movement, as Purnima ji told, any movement is good since वो shoulder restrict नहीं होना चाहिए, range. तो अभी जो attend हुआ है वो भी चला जाए. So mobility is good. This mobility या this mobility या this mobility. Mobility is good, but it should be not only this mobility. What it is like 90 से above हाथ नहीं जा रहा है या ऐसा कुछ है तो एक बार आप देखो आपको क्या जरूरत है. अगर इससे ऊपर हाथ नहीं जा रहा है, आपको नीड है, mobility is good, but to some extent motor control is also important.
Pain free, it has to be pain free.
Yeah,
don't push anything. इतना जोर से खींचने की जरूरत नहीं है. और पेन हो रहा है तो stop it, because that is an indication कि कहीं कुछ tight है, shoulder is out of the socket, whatever it could be. But don't do anything that hurts, and respect the pain.
मैम, आई हैव वन क्वेश्चन. हमारे पीटी ने बोला है कि पहले शोल्डर में मूवमेंट आता है, फिर फोर आर्म, देन रिस्ट, देन लास्ट में फिंगर्स में आएगा. सो इज इट ट्रू?
Not true. Not true.
Not true at all.
Okay. Because my brother is facing similar issues, the one which Shruti ji just mentioned. He's not able to extend his fingers. उसके शोल्डर में कंट्रोल है, शोल्डर में अच्छा खासा कंट्रोल है, बट fingers mein he is not able to extend his fingers. So we asked same questions to our physiotherapist. They said कि पहले ये time period होता है. First shoulders, then forearm, then wrist. After last में fingers पे आएगा. That's the reason.
Some of them do recover the other way. So recovery, कुछ भी movement किया, कहीं भी movement किया तो improvement होने वाला है. So shoulder अगर move हो रहा है अच्छा, then yes, focus on the elbow, because अगर elbow tight है तो fingers are going to be tight. So focus on bending the elbow and straightening it out. That will help. And for the finger tightness, I have made a video with one of the patient. I will forward it to Hardeep ji, and maybe how you can stretch your fingers. उसका अगर कुछ सबको काम आ सके तो मैं भेजूंगी.
Yeah, ma'am, that would be helpful.
Sure. But
Thanks.
Purnima ji, just to carry that, because that is the general understanding, I think even amongst most people, that so-called gross motor movements, they come first, and the finer movements take a very long time. So when you say that there is no such, let's say, Hanji, yes, Forum, you were saying something?
So you rightly told gross motor and fine motor. So gross motor can be, fine motor can be writing, you're picking up small objects that includes your shoulder, your elbow as well as your fingers. There is more movement of your fingers rather than your elbow and shoulder. But gross motor is combination of all. Eating is a gross motor thing. Wearing clothes is a gross motor thing. Okay? So is it कि मैं shoulder से ही मेरे कपड़े पहनूंगी या shoulder से ही खाऊंगी?
Okay, so gross means what is gross? Let's look at that first.
Purnima ji, correct me if I'm wrong, but gross is which includes more joints, larger joints. Gross is eating is a gross thing.
Okay.
But picking up small objects, writing, playing music, that are all fine motor movements.
But holding the spoon is also fine motor, na?
That
if you are able to.
So, ma'am, but if see in India, it is like बहुत सारे लोग ऐसे ही खाते हैं और we can make some modifications in with the spoon or something, and then we can eat if it is possible. So gross motor, if I suppose I do not divide any movement into gross motor and fine motor, I divide the movements according to the thing is complexity. More complex the movement, more difficult it is to attain. Fine motor is like picking objects. It requires tremendous amount of concentration, tremendous amount of your finger strength, your grip strength and all. As compared to eating with a spoon, yeah, wearing clothes, yeah, anything, wearing my specs or wearing my clothes, cleaning, cutting vegetables is a fine motor if we are doing this activity. But there are modified knives available that you can cut भिंडी. वो बड़ा वाला knife से you can cut spinach, भिंडी, भाजी है ऐसा कुछ. So it can be converted into some amount of not fine and not gross, in between. जैसे patient की strength या activities develop होता है.
So just for our let's say layman understanding, I think the difference is the range of motion. If the range is large, then you're going to probably put it as a gross movement. But let's say if the range of motion is smaller, जैसे needle को thread करना है या pebble को उठा के दूसरी जगह डालना है, you would probably classify it as a finer movement. जितना वो move कर रहा है वो.
To some extent, yes. To some extent, yes. It depends on degrees of freedom. We tell it as degrees of freedom.
Again, just to carry that line of thought further, maybe Purnima ji, you can also come in. Why do these, almost opposite statements come in? I would imagine that most physiotherapists would be having, the same curriculum, etc. Then why does it happen that someone says, for example, कि hand के movements बाद में आएंगे, whereas you say ki nahi, or someone says ki bhi electric stimulation kar lo, but someone else says, like for example, what you are saying. Why is there almost diametric oppositions sometimes? I would imagine that all the specialists would be reading pretty much the same things. Why does that happen?
Yeah, just clarification. People are taking people are are taken advantage of with no limited knowledge. That is one thing that is happening. um, Electrical stimulation does not do anything compared to what a skilled professional can do. अगर skilled physical therapist therapy देगी, हाथ से movement करेगी, तो उसका फायदा जो है वो electrical stimulation कभी नहीं कर सकता है. That's one clarification. And going back to the gross movement, ग्रॉस में अगर कप पकड़ना है, मुझे पानी पीना है, तो मैंने हाथ से बड़ा हाथ खोला. अगर इंडिविजुअल फिंगर मूवमेंट नहीं है, फिर भी आई कैन होल्ड द कप. मैं अपने दूसरे हाथ से दूसरे अफेक्टेड साइड्स को पकड़ के ऊपर करती हूँ मैं, तो कर सकते हैं वो अपना. दैट इज अ ग्रॉस मूवमेंट. अगर शोल्डर के लिए सोचें, see everything has to work together, shoulder, elbow, wrist, finger, to bring hand to the mouth. Think about it. अगर वो, तो दैट इज अ ग्रॉस मूवमेंट. पूरा हाथ चले ऊपर तक आ सके तो. और मुझे टाइपिंग करना है कंप्यूटर पे, दैट नीड्स इंडिविजुअल फिंगर मूवमेंट. दैट इज द फाइन मोटर. एंड फोरम गेव फ्यू अदर एग्जांपल्स ऑफ राइटिंग. इट्स अ फाइन मोटर टास्क. बट उसके लिए भी रिस्ट कंट्रोल तो चाहिए, उसके लिए एल्बो कंट्रोल भी चाहिए. सो अगर पहले ग्रॉस मूवमेंट पे फोकस करें, मतलब शोल्डर का मूवमेंट, एल्बो का मूवमेंट इन द राइट वे, दैट इज अनदर वे, बहुत फर्क पड़ जाता है. टू अलाइनमेंट बोलते हैं यहाँ, वी टॉक अबाउट अलाइनमेंट. क्योंकि अगर एल्बो बाहर जा रहा है, शोल्डर एकदम इंटरनली रोटेट अंदर घूम रहा है, तो फिंगर्स आर नेवर गोइंग टू वर्क गुड. And there's a misconception. ये last thing I want to say is lot of patient मैं देखती हूँ, तो उनको finger और hand movement इतना अच्छा है, but they cannot control the shoulder and the elbow. So it can go reverse way. People have lot of times the reverse. It depends on the damage to the brain. कहाँ हुआ है, कितना damage किधर हुआ है. तो बहुत बार देखते हैं कि हाथ बहुत अच्छा चल रहा है, पर shoulder और elbow नहीं चल रहे. So it is never one way or the other. Work together the whole arm. पूरा arm साथ में काम करना चाहिए to get a good effective movement. Thank you all.
Okay. Yeah. Thank you. Thank you. Wilson ji, you had raised your hand. If you have a question, we can quickly ask. Wilson sir. I'm not very sure whether he can hear us. Anyway, I think we are past 9:40. So if anyone else has, yes, Wilson ji, you wanted to say something. No, we can't.
Hello, can you hear me, sir?
Yes, we can hear you now. Yeah.
Yeah. I'm sorry, there was one call, so I just had to. Anyway, now as Forum Madam and we were discussing about shoulder issues. So now what I had been facing right now is the affected shoulder, the affected hand. It is quite better now, or quite good now. That is the right limb, but the left limb with the shoulders, I just don't know what exactly is happening. That some pain has been occurring. That the moment at the backward side, it is not having a very this thing. I can't move my hand, and moreover, the elbow. If you are catching the phone in your left hand, and if you are talking for 10 minutes or 15 minutes, the elbow is also starting paining. So why is it so, or what maybe? Of course, I had been doing push-ups, almost 20 push-ups at one set. Likewise, I do 10 sets. So that is also, but I'm able to do that very properly. But since they are getting up those pains for the last 15-20 days, so I'm not going on for push-ups or something because it is quite painful as such. So what can be the remedies or what can be the effect? Yes, I'm not taking a physiotherapy because I had been taking physiotherapy at this Institute of Rehabilitation at Haji Ali here in Bombay. But they have, after examining me, they said that you can come once in 20 days or so. Hello.
So this muscle, what is your affected side? Please?
Sorry.
Affected side कौन सी है?
Affected side is right, but this issue I'm facing on the left
Left
issue,
side.
the
Okay.
left shoulder.
Yeah,
Yeah.
yeah, sure. The thing is, whenever you do push-ups, your affected side, according to me, I have not seen you personally, but according to me, there can be chances कि वो right hand जो आपका affected है, वो अच्छे
हाँ
से weight नहीं ले पा रहा है. So the whole weight of your body, whole नहीं, more than 25% may be
हाँ हाँ.
coming on your non-affected side, that is the left side, and hence
Right.
there can be overusing of that muscles during any of your activities that is causing you pain. Spasm है
Right.
एक हाथ में ड्यू टू दैट पुशअप्स एंड ऑल,
हाँ हाँ.
क्योंकि वो लेफ्ट पे ज़्यादा वेट आ सकता है. सो देर इज ओवर एक्टिविटी, और जब भी आप वो काम कर रहे हैं सिंगल हैंड से, जैसे फ़ोन यूज़ करना है ऐसा कुछ, वो स्पाजम है इसीलिए वो पेन कर रहा है.
हाँ.
So the thing can be, you can take contrast, that is 3 minutes of ice and 4 to 5 minutes of hot pack on left side. Yeah, you can take after exercise you can apply ice for 5 to 7 minutes, and then just let the arms get relaxed. You can do
Okay.
some stretching in this manner for your thing, and then progress towards exercise.
Okay.
Agree
Okay.
with, agree with Forum. It is the
Yeah.
overuse of your unaffected side that is what is causing you the
Right.
Pain.
Right. Right. Yeah.
over.
It maybe. Yeah. Uh, I do agree on that. It may be happening that way. Well, thank you so much for giving me the insight of this.
Okay. Any other query? Anyone
No.
else?
आनंदी
Fine.
जी,
Thank you.
आपके हस्बैंड की प्रोग्रेस के जस्ट यू कैन जस्ट फॉरवर्ड द प्रोग्रेस आफ्टर डूइंग consistent activity for 3 to 4 days या 5 days.
I should forward the progress.
माने what difficulties has been reduced in next session if possible,
Okay.
so that we can make some changes.
Again, if
Just
I can
help
come in,
out.
Anandi ji, what we discuss, for example, bending and standing, etc. Is the physiotherapist not telling you this?
No, he's not doing anything. Because initially I also felt after the last hospitalization, maybe there has been some weakness in the back, and the doctors also said that it will take him another 3-4 months. So after December end, January, February, March, April, it's almost 4 months. But what I feel is on Saturdays when the attendant goes home, so he does wet the bed even after the diapers. So I have to make him stand. So now I'm noticing that he's able to stand with the support of his left hand, but I have to be very careful. The attendant keeps telling me कि आप देख लेना जो है पूरा weight आपके ऊपर डाल देंगे वो. So but anyway I have to change his clothes. I do that and then make him sit on a chair.
See,
So,
that
but
is
now
something.
because I have to do it and he's conscious of the fact that I may not be able to handle, so he also makes that effort. But I have seen that the physiotherapist, he should be knowing what kind of a strength he's now gaining. So he's not working on those things. Suddenly I got this revelation today.
See, to carry forward from there, Purnima ji, as well as Forum, because the fact of the matter is, we as lay people, unless we have sessions like this, You know, we will never know.
Yes.
हम तो भाई जो कर रहा है वो ठीक कर रहा है. You know, so I wonder if there are people like us, you know, maybe some books, maybe something that we can take as a, let's say, a reliable source and look at that in addition to whatever is happening. Are there any such books for the lay people?
There are some techniques demonstrated in some illustration, some brochures. I need to just find out and give.
Long ago, I was told of some black book or something like that long ago. I don't know whether that some red book or something like that for you know, exercises.
हरदीप जी, आप आनंद जी को वो हमारे सेशंस अगर लिंक फॉरवर्ड कर सको तो.
हाँ, वो मैं रिपीट कर दूंगा. सारे सेशंस हैं वहाँ पे. You know,
previous session, because in that session we had emphasized on only upper limb, only sit to stand, only gait. So whatever help she can get from that sessions.
For sure, all those sessions are. I will repeat the links. At the same time, they are available on our channel also. And one thing that I mentioned to you forum last time that we met, I'm thinking of transcribing them also, so that you know, it becomes easier as to what is in each of those sessions. That is something that we can do. तो वो मैं ग्रुप पे भी डाल दूंगा. And also maybe जैसे आप कह रहे हैं, even Purnima ji, if you can send small videos, you know, of opening hand or how to stand properly. Of course, after all that, it is for the patient and the caregiver to carry that forward. You know, that is of course there. But for sure, I will put those links. In fact, I'm thinking of making a directory of all the video sessions. It's taking us some time, but that is there in my back of my mind. Ki one page, जितने भी sessions हैं, उन सबके links and some small description वगैरह वगैरह पड़ जाए, you know, so that people can refer to them. We have a lot of sessions, about 50 odd, in fact, that we did. There's a lot of information, a lot of useful information there, and that is what I'm working towards. Okay,
Last
fine.
thing, Deepji, I just, you know, if you go on American Occupational Therapy Associate, AOTA.org, uspe choosing wisely, I had sent you one time, okay, you know, you should, what the patient or anybody should be questioning their therapist or their doctor, whatever they are doing, what they should, I mean, they should not let their therapist do. So choosing wisely, if you Google that, you will get all that information. Or AOTA के website पे, it is available to anybody and everybody.
Okay, great. So, I will have I'll have a look at that. Probably we can transcribe that and maybe translate and also put it on our website. You know, that information for everyone to access. Yes. Yeah. Sure. Thank you very much.
They talk about the electric stimulation, pulleys. You should not be using. All those things are there. And, you know, there's a science behind it. So please, yeah, thank you.
Okay, fine. Fine, I think we can close the meeting. We're almost at 10. So I hope it was useful for all. And certainly we can take more queries next time. So thank you very much, Purnima ji, and thank you very much, Forum, for all your efforts.
Thanks a lot.
I really appreciate it. Thanks everyone for joining in.
Thank you so much, Sodhi ji, Forum ji, and Purnima ji. Yeah.
Thank you. Good night.
Good night, everyone, and look forward to more and other joining in next week also. So thank you very much. I'm closing the meeting now. Thank you.
Bye. Bye, sir.